All right. Good morning, everybody. Sorry about all that. Not sure what happened there, but happy Thursday morning. My name is Becky Kinnaman, and I am a broker advisor at Cornerstone. I am joined today by our representatives from UnitedHealthcare for the second webinar in our fourth quarter update series. First, we have a little bit of housekeeping. If you have any questions throughout the presentation, please type them in the question box and we will address them during the Q&A at the end. My information is on the screen if you would like to get in contact with me. And don't forget to follow us on social media and subscribe to our weekly Monday Minute newsletter. We keep you in the know with any industry and Cornerstone updates and information. Contact your Cornerstone broker advisor if you are not currently subscribed. Last week, we launched our new Cornerstone brand to signify a new chapter in our company and our commitment to change and adaptation in the industry. Our goal with this rebrand was to simplify and refocus our message and the role we want to play for our brokers. Now we look towards growth, both the growth of your business and of ours, but don't worry. While our look has changed, we still offer the same great service and you will experience no disruption in your day-to-day communications with your broker representatives. Check out the new Cornerstone website at www.crnstone.com. The new and improved AGB portal, broker portal, is now available for all of our broker partners as your one-stop shop for managing your book of business through Cornerstone, from carrier and client information to commission schedules. If you have any questions about the new platform and your access, please reach out to your broker advisor or the AGB support team. All right, I'm going to hand it over to you, Mike.
Thank you, everybody, for joining us. Today, we're going to hear about some updates for 1/1 for UnitedHealthcare Small Group. The agenda for today is to talk about 4 different areas. First, we're going to be talking about Ohio Chamber MEWA. Again, my name is Ed Lykep. I'm a small group AE for the Cleveland, Ohio market. Then we're going to be talking about our UHC level funded product, and Mike Payton, which is a small group sales rep in Southwest Ohio, will be presenting that. Third, we'll be talking about ACA updates, and Whitney Robinson, the AE for Toledo, will be talking about that. And then she will also be talking about specialty benefits with small business. Now, one thing that we did want to know, and you guys are really the first one hearing about this, is that we are actually ready to start quoting our January 1st effective dates for our MEWA. Last year, we probably started around first or second week of October. We decided to start it early to allow people that do want to market earlier than normal to get those RFPs in to make decisions earlier. And that way, it's going to actually help us be able to manage our pipeline of quotes once we get more into the November area. So we definitely encourage everybody to submit RFPs for our MEWA as early as possible. Again, we are ready to quote 1/1 and just send those RFPs into us now like you usually would. Now, one thing we really want to talk about, and we've talked about this in previous meetings, is that we really want to make it easy for people to quote and get an underwritten rate for our MEWA. So last year for 1/1, we introduced hassle-free underwriting, where we will underwrite groups with a member level census. We actually were only going to do it for 1/1 last year, and it went so well, we extended it to 3/1, then we extended it through 5/1. We've just made the executive decision that it was working so great, and we captured a lot more quotes on groups that probably wouldn't quote otherwise, to basically do it indefinitely. So this is something that we were doing in small business for the MEWA, and there is no end date on it. So it's something that we're continually doing as we speak now. The couple things that you do need to remember is there are a few rules to it, and the group does need to have at least 10 enrolling employees to do the member level census underwriting. The group has to have current coverage, so virgin groups are excluded. And on the census, we must include at least 5 different data points: first name and last name, gender, date of birth, and home zip code. And what we need on that census is all enrolling members. So that's going to be employees that are enrolling, spouses that are enrolling, and children. If we can capture all that data, the group has 10 enrolled and they have current coverage, we can provide you an underwritten rate with that member level census. Now, to let you know, we are still underwriting groups with employee applications. And we did change our rules on how long those applications are good for, and it is now 120 days. And that's something that we're just not doing for the busy period like we have done in the past. It is permanently going to be 120 days old. So groups that are filling out employee applications right now, those are going to be valid, and we can use those for installation for 1/1 business. It's really up to you how you want to submit it for underwriting. If you want to use the member level census or employee applications, just know that when you do submit that RFP to us, we will continue to underwrite and install the group the way that you submitted it originally, meaning via apps or via member level census. Again, one of the reasons we're doing this is because we do see a lot of groups that maybe get a manageable renewal and don't really realize how high their rates are compared to the rest of the market. So this just gives an opportunity for you to do a market check to see where underwritten rates are with our Ohio MEWA, and we have won a lot of business because of this. So please continue doing that. Another thing this is a common theme, is we did change earlier in the year that we have multiple common renewal dates for our MEWA. So just to let you know, for anybody quoting effective dates currently all the way until 12/1 effective dates, those groups are automatically going to renew on September 1st next year. Groups that we're going to get in for January 1st will renew January 1st of 2014. Now, one thing we really wanted to talk about too is we've changed the portfolio a little bit. Last year, we changed it and made it a smaller portfolio. Basically, we pick plans that we know sell and we know that we're competitive on, and we decided to not have a product portfolio of a bunch of plans where people got lost in it and really didn't know what to sell. We're continuing that strategy. Our portfolio for 1/1 business is going to be 9 plans for a MEWA. We just got the updated product grids, and we will be sending out a blast email probably over the weekend to let you have that information. But I kind of wanted to highlight key things that we've done to our portfolio for 2023. So if you look at our HSA plans, we really weren't selling a whole lot of HSA plans because we didn't have a good premium price point for those plans. We really took a look at the benefits of it, and we determined that if we would switch the co-insurance from 100% to 80%, we got a really great price point by doing that. We know that not all brokers are used to selling in groups to an 80% co-insurance plan. They're used to 100%. With UnitedHealthcare, even our 100% HSA plans that we sell today do have responsibility after a person meets the deductible, and that is through co-payments for services like office visits, ER, urgent care, and also RX. So there is the real change is instead of having co-pays for some of those services, you will have co-insurance. Other than you will still have RX co-pays. Very few people actually hit their HSA deductible. So this really only impacts a very small percentage of the population. A lot of that population probably would have satisfied their out-of-pocket max on their HSA anyway, even with the copays. So there's really not going to really be that big of a change. And we get a great price point by doing this. As an example, we do have 3 plans that we're going to be marketing next year: a 3,000, a 5,000, and a 6,000 deductible 80% plan. The 3,000 deductible 80% plan is around 16 to 18% cheaper than a 100% plan. So again, it is definitely worth the premium savings. Another thing that we changed is that our RX copays are going to align more of what we already did with our ACA portfolio in our UHC level funded portfolio, where we will have 4 separate tiers for our specialty medications. It really is not that big of an impact. The only impact is if you're on a tier 4 medication, that copay for the specialty medication will be $500 versus $300. So again, minimum change. And then lastly, our plans are adding something that we call designated diagnostic provider. It's something that we've already done in key accounts. It's something we've already done with our ACA plans this year. I will be explaining what that is in further slides. And then also to let you know, performance plans. Those are our PPO style plans. Those are the plans that are our top selling plans, and we expect those to continue to be the top selling plans. We have heard from the agent community and our GA community, and they did indicate that we need some richer options for employer groups. Currently in 2022, our richest plan is a 2,080% plan. So new for 2023 effective dates is going to be a $500 deductible and a $1,500 deductible 80% coinsurance plans. Really excited to have those. We appreciate for those that reached out to us and said, hey, we needed those plans. We listened to you and we decided to add those. Our whole portfolio of performance plans, PPO style plan, will be 480% coinsurance plans and 200% coinsurance plans, keeping with the theme of let's just offer minimum plan designs and ones that we know groups are taking, and we are competitive with a price point. And then the other two changes I've already kind of go over with the HSA is the specialty medication copays and the designated diagnostic providers. Another change that we're doing for the MEWA, and this is for 1/1/23 effective dates, is we are moving our pharmacy network to what we call our standard select pharmacy network with Walgreens as the anchor. This is something that we are already doing with our ACA business that we sell this year. It's something that we are already doing with UHC level funded this year. We are just trying to make things as easy as possible, and we're doing it with the MEWA for 2023 effective dates. And basically what that means is we don't want people to think that as much as we use the term Walgreens as our anchor pharmacy, that doesn't mean Walgreens is the only pharmacy. Basically what it is it's our entire broad pharmacy network that you may be used to selling. The only thing is it excludes CVS's. So if you see on the very bottom of the screen, it says exclusion is CVS. That's also going to include Target to let you know, because those are CVS's as well. But it is still, other than CVS, is our broad network. So if you look on the screen, it includes Cleveland Clinic pharmacies, Costco, Drug Mart, Giant Eagle, Marks, Myers, Rite Aid, Sam Club, Kroger, Metro Health, Walgreens, Walmart. So it's still our huge network provider. It is just CVS are going to be excluded. So just be aware of that. And one thing that's going to be that's going to stay the same is all the different wellness benefits that we offer our MEWA portfolio. Whether it's our virtual visit providers, whether it's Real Appeal, which is our 52-week weight loss program that's been extremely successful, whether it's Rally or discounts off Apple Plus Fitness and Peloton. A big one too is Motion is attached to all our HSA plans. That's the program where you meet certain walking requirements and you can earn up to $3 a day for enrolled employees and enrolled spouses, which equates to almost $1,100 for enrolled employees and $1,100 for enrolled spouses if they max out that benefit. So there's going to be no changes to those wellness programs for January of 2023. Next, I wanted to touch on designated diagnostic providers. This is a benefit that is going to be changing for MEWA plans in 2023. For those of you that are familiar with selling UnitedHealthcare, especially, let's just say, larger style groups, 51 plus, this is a benefit that has already changed for 2022. So it may not be new to you, but it's going to be new to the MEWA portfolio. And basically what it is we are going to tier outpatient labs and imaging facilities because there is a big cost disparity with some providers versus others. This is only going to apply to, and it's up in the upper right-hand area, minor lab services and your major diagnostic imaging services, which are your CT scans, your MRIs, your MRAs, your PET scans, your nuclear medicine. It's only going to apply to those benefits. We do see no carrier really has done something like this, and we really want our members to know, that, we look at our lab providers and make sure they're providing high quality and also efficient as far as cost. And we want to share that information with our members, and we're modifying benefits a little bit for those designated providers that are providing great quality and efficient lab work. If you see on the bottom, our first thing is UnitedHealthcare Preferred Lab Networks. This is something we really haven't talked about in small group, more of key accounts, but we do have preferred labs across the country. All of them meet our designated diagnostic provider status. those are going to be your large labs like your LabCorp and your Quest Diagnostics. Those are all included. We've also reached out to freestanding facilities and outpatient hospitals to see if they can meet the quality and efficiency. And for those that did, they are going to get the designated diagnostic provider designation. And then lastly is there's just going to be national carriers that are also maybe not one of our preferred labs, but meet this qualification. For those in Ohio, ones that stand out is Path Labs and also CompuNet Medical Lab. That's more of a Dayton area. But again, it is a lot of providers that meet this. We call it DDP status. And we just want to make healthcare as affordable as possible and as transparent as possible to our members to let them know what the real costs of services are. And that's where we're modifying this benefit a little bit. Here is how it's going to basically work. So people that go to get the minor lab work or the diagnostic, the imaging, if a member goes to one of our DDP designated providers, the member's going to pay a lower cost share, and that's going to be what their normal benefit is, which is deductible plus plan coinsurance. If a member is going to use a non-designated provider, the benefit change is going to be they're still going to pay their deductible first, and then the coinsurance is going to be 50% instead of the plan coinsurance. Now, there's a couple of important things to point out about this. Services that are not impacted by this are emergency room visits, an observation event, any inpatient admission, services that are performed in a physician's office or urgent care. And I do want to let you know when we talk about that, if the physician is sending out lab work, that is not the same as a physician office doing it in their office. So if a physician office or urgent care is doing a lab work right there in-house, this will not be impacted. Also, pre-op testing for outpatient surgery is not impacted by this benefit. And then if you look to the right too, we just want to let you know that, x-rays, ultrasounds, and mammographies are not part of this benefit either. One thing I really wanted to point out too is what products that this really does not apply to. UnitedHealthcare has a lot of different plans throughout the country in different states. I've kind of highlighted for you the ones that stand out in Ohio, so this does not apply to all savers. It does not apply to any of your grandfathered or traditional relief groups that you have with us. It doesn't have anything to do with UnitedHealthcare Navigate Now, which Mike Payton will be talking about a little bit later. For those that have sold our Nexus ACO in the past, it's not going to be impacted by those. And also UHC level funded. Now, one thing we also want to let you know is what the member experience is going to be. So when people have this designated DDP designation, all the member's ID card will indicate that with an indicator on their ID card. We will be doing member communications, targeted emails, and direct mail campaigns to members to let them know about this. Our network, our provider team that works with our providers is always actively educating our providers on this benefit as well. If we do recognize that a provider is referring people to non-designated providers, we will do outreach to those providers to let them be aware that, hey, you know what, there is a possible difference in the benefit for members. Be aware of that when you are sending lab work to other labs. And then one thing we wanted to make it easy as possible, we really didn't want to catch people off guard. So if a member does, let's just say, go to a lab or have some imaging done, and they weren't aware of this benefit, and that they've actually used it a non-designated provider, we will provide a one-time exception to let it be covered as they were designated, one time for minor lab work and one time for major diagnostic testing. The member does have to reach out to customer service to initiate this, so we do not proactively do this. Providers cannot call this in. Let's just say either it needs to be the member, but the member just needs to appeal it. It's not an automatic process, but the first one will be granted automatically. And then once that happens, we will educate our members on the benefit to make sure they understand moving forward. And the referring physician that provided that referral to get lab work will also get educated on this program. So we're trying to make it as easy as possible to let all our members know about it And in those cases where a member overlooks it and wasn't aware, we are going to grant those one-time exceptions. So that's what I have as far as talking about the MEWA and DDP. I want to thank everybody for the time that you've had just to hear me, and we are going to pass it over to Mike Payton to talk about UHC level funded. But again, please give us an opportunity to quote any of your business. We're making it easy with the member level census. I think you'll be surprised sometimes for groups that didn't want to market that we have an opportunity to be competitive, and we've been winning business that way. Mike?
Awesome. Well, good morning, everyone. For those who don't know me, my name is Mike Payton. I'm your UHC account executive located in Cincinnati, Ohio, and I cover the Cincinnati and Dayton area. So I'm here to talk to you about today is UHC level funded. To kick things off here, just want to let you know that quoting for 1/1/23 effective dates is now available, just like the MEWA. So if you have groups that want to quote early, please feel free to send those in now. It is available and ready to quote. Also, I want to let you know about UHC level funding effective dates. So every 9/1, we update our portfolio. So please make sure that you are reviewing the most up-to-date portfolio or plan grid that will be sent out with the quotes. If you don't have that, please feel free to reach out to your Cornerstone broker advisor and they can pass that along. Go ahead, next slide, please, Ed. So level funded is a great option, especially if you have a group located in other states where the UHC MEWA is not available. Since we began our journey back in 2013, we were a pilot in a small group market, an alternative to adjusted community rating. We strive to listen and act on recommendations coming from our market and brokers. UnitedHealthcare level funded is nationally marketed in 47 states plus the Virgin Islands for all savers. The Affordable Care Act created a market for products like UHC level funded because fully insured products in this market cannot, 1, medically underwrite, 2, rate on a 10-to-1 age gender band, and 3, rate on industry factors. So UHC level funded offers coverage comparable to fully insured plans at a lower price. Plans are in progress to launch in New Hampshire later this year. So this leaves only 2 states where we do not market level funded, which are Hawaii and Vermont. Virgin Islands are also currently sold as all savers, but will move to UHC level funded in 2023. Next slide, please. A few bullet points I want to review with you, and just like the Ohio MEWA, UHC level funded, we can actually quote using a GRA member level census. So if you have a group that has 10 or more enrolled employees, also excludes virgin coverage, please send that member level census in. Even if you want to quote the MEWA and level funded or just the level funded itself. If you were to quote the Ohio MEWA and want to receive a level funded quote as well, you must request that in the RFP. So please notify Cornerstone that you want to see a UHC MEWA and UHC level funded quote, and then we'll send that in. We'll quote it both ways. Also, I do want to let you know that level funded, every state has their own rules. So today I'm going to focus on Ohio, Kentucky, Indiana, and Michigan because those are the most commonly quoted states that we deal with in Ohio. So GRA is available for all 4 of those states. Level funded participation, it's 50% all eligible employees. So we don't look at valid waivers. You must have at least 50% to enroll. UHC level funded PDL. So when you do request a UHC level funded quote, our default PDL is going to be our essential PDL. But I do want to let you know that if you want to see an advantage PDL, which is a tad better when it comes to PDL, you can request that. It will be a small load to the rates, but you can also request that with UHC level funded. As Ed mentioned earlier, the pharmacy network is the standard select network with Walgreens. It's a very, very strong network for both essential and advantage. It's really excluding the CVS and the Targets. So really, if you look at our network for pharmacists, there shouldn't be any challenges at all. We do have a large portfolio of plans. The most commonly asked question I get is, hey, Mike, what are your EPO plans? So if you look at our plan grid for level funded, we do offer EPO plans. What those plans are, they're in-network only plans. It's approximately 3.5% savings to on the premiums to the group and the members. UHC's got a very, very large network. I'm not saying we've got every doctor in network, but it's very strong where I feel confident that we can, or a group or client can offer an EPO plan that is in network only and take advantage of those additional savings. Next slide, please. So when it comes to UHC level funded, motion is available on all plans, even non-HSA plans. So keep that in mind. Virtual visits, it's provided by HealthySU. So virtual visits is actually covered for non-enrolled dependents. They're actually eligible as well. Not sure if you knew that. It's zero cost for non-HSA members, but if you are enrolled into an HSA plan, there is a $45 cost for those members. Domestic partner coverage. So starting 12/1 of 22 this year, domestic partner coverage will be an optional. So currently it's automatically included. So starting 12/1, the UHC level funded employer application will include an option for groups to select yes or no. So just make sure you take note of that. We do offer free COBRA administration. It's available through United Benefit Services for groups with 20 or more eligible employees. Next slide, please. Another update that I want to talk about on UHC level funded effective 9/1 of 22 is our specialty medications. So again, it's only for specialty meds. Prior to 9/1, if a member were to go fill a specialty med, they can fill up to a 90-day supply. We are changing that to a 31-day supply, and it's actually a positive. It's really the changes is the impact of the large dollar specialty claims and the exposure the employer has when an employee terms and obtains to fill the prescription right before termination. This has occurred on several occasions where the employer has asked for the fill to be reversed or recovered, and when it comes to medication, especially specialty, we're unable to do that. So leaving the employer with a higher cost claim for future months that employee didn't have covered when the employee didn't have coverage. So really, this has been a challenge that we've noticed over the past year, and we are changing the specialty meds from a 90-day refill to 31 moving forward. Next slide, please. I've got some great news when it comes to fourth quarter and level funded rate guarantees. So UHC will be offering a 12 or 15-month rate guarantee in the fourth quarter. So again, going back to every state has their own rules. So just focus on Ohio. So if for groups located in Ohio, a 12 or 15-month rate guarantee will be available for effective dates of 11/1, 12/1, and 1/1. For groups located in Kentucky or Indiana, the 12 or 15-month rate guarantee will be available 10/1, 11/1, 12/1, and 1/1. If you have any groups located in Michigan, they unfortunately will not be offering the 15-month, so 12-month rate guarantee is only available in Michigan. The way the 15-month rate guarantee works out, so the beauty about the level funded is that employers have the option to earn a surplus at the end of the year. So if you look at the chart in the middle of the screen, and let's focus on an 11/1 effective date, if a group were to enroll into the 15-month rate guarantee, the effective date will be 11/1, but the surplus reporting won't start until 2/1 of 23, and then it'll end on 2/1 of 24 if they are eligible for the surplus that will be paid out on 5/1 of 24. Also, I do want to mention that starting with these effective dates, if it's an Ohio group, Kentucky, or Indiana, so when the effective date starts for the 12 or 15 months and we were to sell a group together, during implementation, we will require a 12-month or 15-month rate guarantee document to be signed. So please keep in mind, if we were to implement a case starting 11/1 for Ohio or 10/1 for Kentucky or Indiana, we will require a 12 or 15-month acknowledgement for the rate guarantee, just so we have that on file. Next slide, please. Next, I want to talk to you about a new plan that's called Navigate Now. So today, consumers want an affordable health plan that is simple and offers comprehensive support. So with a typical health plan today, 29 days is the average wait time for an appointment with a primary care provider. The average time spent in the waiting room before seeing a PCP or primary care provider, it's 18 minutes. And only 1 in 10 consumers see their regular doctor the same day they need care. So with Navigate Now, the wait time to see a provider may be shorter than the average wait time for in-person care. And actually, new patients have a great chance to schedule an appointment within 24 to 48 hours. Next slide, please. Before I get into the details of how the Navigate Now plan works, I do want to let you know, if you look at the screen, the Navigate Now plan option is currently only available in the Columbus and Akron-Canton counties that are listed on this screen. So if you have a group located in the Columbus or Akron-Canton area, this will be available to them. Next slide, please. So what is Navigate Now? It's a virtual first product as opposed to virtual only. That means that rather than a member calling their doctor and having to schedule an appointment to go to the office to address their health care concerns, they will initiate access into the healthcare system via the mobile app or web portal, which is available to members 24/7 or 365 days a year. This will connect them to their care team. It is determined that an in-person care is needed, then the care team will coordinate that. So the care team will consist of a dedicated PCP, so primary care provider, and nurse who know the patient and will be their ongoing provider. So when you think of virtual visits, you think of having an urgent care need and you're not able to access your regular provider. With traditional virtual visits, you'll see a virtual provider each visit. Navigate Now is more than a traditional virtual urgent care visit because you have a dedicated PCP or primary care provider you're able to develop an ongoing relationship with. And they've got access to your medical history, manages your care, and helps them navigate the medical system. The goal is to develop the member and the primary care provider relationship with a level of trust between the team and the member. This is what makes Navigate Now stand apart from just a virtual visit. The PCP or primary care provider is supported by an extended care team that consists of clinical and non-clinical staff, depending on the needs of the patient. So with Navigate Now program, the primary care provider has access to and the ability to pull in a behavioral health provider on a virtual visit if necessary. And the reason is so that it's so important is because right now, due to the current rural situations, we understand that 75% of clients have indicated that behavioral health is their #1 priority. So you likely have been having several conversations with your clients regarding behavioral health. So not only is the PCP able to care for the person as a whole by looping in a behavioral health provider if necessary, members still also have access and can self-refer to a broad behavioral network. Urgent care needs are also included, but either virtual or in person. Next slide, please. Navigate Now delivers a plan sponsor plans. It can actually save members up to 15% compared to a UHC level funded Choice Plus plan. It's guided navigation to in-person care will provide UHC premium care physicians, freestanding facilities, and other quality cost-efficient providers when available in the national Navigate network. So Navigate Now offers simple and transparent copays for common services. These include $0 copays for PCP, primary care providers, behavioral health, and virtual visits for urgent care. There's a $50 copay for in-person urgent care visits, $75 copay for specialists, and $0 copays for Tier 1 prescriptions. I do want to make one note is Navigate Now must be offered as a dual option with another UHC level funded plan. Navigate Now cannot be the only plan offered to employees. Next slide. And to wrap things up with Navigate Now, how it works is it's really easy. So when a member enrolls into UHC Navigate Now, the first step is activation. So an employee or a member would log in and activate their profile by creating a username and password. Then they will then need to answer a brief health history questionnaire. It takes anywhere between 2 and 5 minutes to complete. And then based on your health answers, UHC will recommend a virtual primary care provider for you. You will need to select a primary care provider in order to begin. If you have more than one member on the plan, your family does not need to select the same PCP or primary care provider. Each member can select their own, which is nice. The virtual care team they're there when you're in need of medical care. So the Navigate Now team is ready to assist you. This team consists of 1, a primary care provider, 2, a nurse that provides education for patients, assists with prior authorization requests and lab orders, closes the loop on test results, and supports 24/7 virtual visits as needed. You also have a care provider. They help coordinate referrals, share convenient locations, and identify network providers at the point of care. They also provide white glove service, including appointment scheduling. Behavioral care, they include licensed clinical social workers. They provide care from the comfort of the patient's home. Also work or any private location with internet connectivity. And then we also have technical support, and they assist with questions related to tech issues. Once you select a PCP or primary care provider, this will be your primary care provider for all future visits. Navigate Now does not include any out-of-network benefits, so it's very important that you schedule an appointment with your virtual primary care provider before requesting any type of in-person doctor visit. The network members will utilize for this is called Navigate Network. They're always available to assist you with any questions you may have. Overall, with the technology and resources UHC has to offer, this could be a really good opportunity where employees are located in Columbus or the Acton or Canton area. If you have any questions on Navigate Now, please reach out to your Cornerstone broker advisor, and they can also put us in contact as well. So now I want to pass over to Whitney Winters, who's going to talk about ACA.
Awesome. Thanks so much, Mike. Appreciate it. Hello, everybody. My name is Whitney Robinson, and I'm the Toledo, Ohio account executive. Just wanted to thank you all again for taking the time to meet with us. I am going to end the presentation with a couple different topics. I'm going to cover our ACA portfolio, our new UHC rewards program, and then I'll end with highlighting our 2 specialty programs that we have in place as well. So first, talking about our ACA portfolio. We get this question every year, so I wanted to start with what package should you be quoting? So the Evolution package, and this year it's Evolution Package 50, is the most competitive new business ACA package. We also have the product grids for Heritage and Legacy, but we use those for existing groups. So always make sure to just stay with that Evolution package. And really just speaking about being competitive, we've ran some test quotes this year for our ACA portfolio, and we're going to be very competitive this year. If you can remember in years past, UHC was really a leader in the ACA space, and we're looking at this year being very competitive as well. So for those groups that the MEWA or level funding is just not going to make sense, we highly suggest you taking a look at our ACA product this year. And a few highlights around ACA that I just want to make. First is you can offer as many plans as you'd like, but they do have to be on that same multi-choice package. So all of your plans are just going to be needing to be on that Evolution package. Then next, something that is new this year. So with composite and age banded rates, we used to just only allow composite rates for 10 plus eligible, but now we're going to allow composite and age banded rates for all group sizes. So what we're going to do is basically default to composite rates, and then if you are looking specifically for a group to have age banded rates, you can just let your broker advisor know that, hey, I would look for a age banded quote on this group specifically. But if composite works for you, all those ACA quotes are going to just automatically be composite rates. Then the next thing, as I already briefly touched on, is UHC rewards. This is a really cool, innovative program that we're rolling out that's going to replace the value adds that we have in place already for ACA. And UHC Rewards is really going to be the future of our value adds. Ed kind of touched on the different value-added solutions in the MEWA, and I know you're all familiar with the level funding value-added solutions. Those are going to stay in place for right now, but ACA, we're rolling this out as a pilot right now, and then we'll keep you updated on any further changes. I do have 4 additional slides I'll cover and give you the details on that as well. And then next is the simpler portfolio. As you can see, that's really our goal at UHC, is to make things more streamlined and simple. And we're doing that with the ACA portfolio as well. So what we did this year is we removed the Nexus ACO plans, the Assured plans, and the Premier plans. And we're really just streamlining things to our most competitive plans that are going to make sense for small groups. And then the last couple of notes I'll make is the DDP program that Ed went over, that is not available on UHC level funded or current All Savers groups. So that is excluded. And just to mention the Standard Select Network, that does apply to the ACA portfolio as well. So that's really on all 3 of our products. Next slide. And next, I wanted to just touch on this briefly. We do have a quote and enroll tool within UHC eServices, but I do know that most of you go through Cornerstone for all of your quoting. Please continue to do so. But if any of you do have used SAM in the past, just wanted to make note that SAMX has been upgraded and it is in uhceservices.com. But what I really want to focus on here is that new website. We used to have the My All Savers website and United eServices. You used to have to go to 2 different websites, but now we streamlined everything into one great website, which is uhceservices.com. I highly suggest before Q4, if you have not already gotten in that website, I would do so. There's a lot of great tools outside of just quoting and enrolling groups. You're going to get access to things like benefit summaries, which I'm going to touch on the next screen, and access to your groups in general. So I highly suggest doing this. And if you want to move us over to the next screen, I'd like to highlight this tool, this SBC and benefit summary tool. This is a little bit newer, and I've noticed a lot of brokers that I work with not knowing about this yet. So I know sometimes in the past it could be cumbersome figuring out where to go to for benefit summaries and SBCs. Now we have this great tool, so when you log into the website, you can go to that resources tab at the top, and then you'll see this screen here. And what you can do is select which funding type you'd like. So you can get fully insured and level funding, SBCs and benefit summaries all on this screen right here. Then you're going to select your group segment, so small group or mid-size, your state, plan year, and then your medical codes. And then all of that's going to display right there, and you're going to be easily able to download those SBCs. Also, you can actually get the dental, vision, and financial protection product benefit summaries and SBCs as well. And then the last note I'll make is you can still feel free to go to your Cornerstone team or come to us if you'd like to see those SBCs and benefit summaries for the MEWA specifically. So again, this is just for fully insured and level funding at this time. Then next, I'm going to get into UHC rewards. As I mentioned, I just wanted to cover what this new program looks like. If you can go to the next screen, Ed, want to highlight a couple of things on why we're doing this. Why are we changing up our value-added program? So really getting employees to take part in wellness programs can be a challenge. So while 87% of employees have access to mental and emotional well-being offerings, only 23% of employees are actually utilizing them. So the result is 53% of healthcare costs end up being wasted. So on the next screen, so what we've really done is combine the best practices from our existing health and wellness incentives, and now we're taking things a little bit further with UHC rewards. So some things we're doing is offering a registration incentive for completing onboarding questions and pairing a device to the program. We're adding wellness activities built to help with better sleep and regular exercise. And then we're also integrating the UnitedHealthcare digital experience with the UnitedHealthcare app, which is just going to make things much simpler because many members are already using that MyUHC app today. So participants need to meet one healthy goal per day, and then they can earn up to $300 per participant per year with our core program, which I'll explain on the next screen. And then they can earn $1,000 per participant per year with the rewards premium program. And how those earnings look, they can either be deposited into an HSA account, which is currently how things like Motion work right now, but we're also offering Visa gift cards, and they can earn electronic devices and things like that. So I think it's pretty cool that we're going to give multiple ways to earn money and to use the money that's going to be earned from the rewards. And some different ways that people can earn. So here's a look at the two different programs. As I mentioned, you can see these two columns here. There's the core program and the premium program. And how that's going to look is based on the state you're selling an ACA group in, it might be on the core program and it might be on premium. So if you're selling an out-of-state group, feel free to come to us. We'll help you figure out which one it is. But in Ohio specifically, I'll just touch on that one today. All the HSA plans have the premium benefit, and all the non-HSA plans have the core benefit in place. So if a person utilizing this program does not have an account at myuhc.com, they're going to need to register, and then they're next going to download the app, and then they're going to pair their device. And what they can do is earn in ways as you can see on the screen here. I think what's really awesome is that there's a lot of money here to be earned. As you can see, like for the biometric screening, you can earn $50 on the core program, and you can earn $75 on the premium program. You can do sleep tracking for 14 days and earn $5 or $10 on premium. So this is real money, and I think this is really going to excite people when they see this new program roll out. And on the next slide here, I think this is a really great way to just explain this to members, because really the program is simple. All you're going to need to do is register. You're going to log in using your HealthSafe ID, and then new users will need to go to the myuhc.com website and just create their account. Then they're going to activate their device, sync their device, and then the engagement piece starts. They're going to see the list of items that they can do to earn money, and they're going to just be able to check on that daily and sync the app. And then they're going to earn that real money within their HSA or a Visa gift card. So again, if you have any questions, this is a newer program. All your local account executives are happy to help here. And then I'm going to end with specialty benefits, as I mentioned. So we have two different programs in place. We just wanted to make sure we highlight both of these because UHC, we are a specialty carrier. We have great specialty lines in place, and we're happy to help you with those as well. So first program would be our package savings program. This is for UHC level funded and ACA groups only. So this is not for the MEWA, but package savings hasn't been in place for many, many years. And this is a great program that many brokers take advantage of. But just wanted to highlight how that looks. You can bundle and save. You're going to have one admin system. Obviously, employers have a lot on their plate. They're trying to streamline things. Why not have all of your specialty and medical in one place? And you can earn up to an additional savings. So dental, vision, life, and short-term disability, if all of those lines are sold with a group, you're going to earn $7 per employee per month back. But let's just say a group wants to sell just dental with a case. They can earn $3 per employee per month back. So great way to bundle and save. And something that's really cool is we have another program that's in place for the MEWA and for both UHC level funded and ACA. So that program is our specialty bundling credit. You may or may not have heard about this, and we really wanted to take time to make sure that you know about this for upcoming effective dates. Initially, this was only supposed to be throughout the end of the year, but we've seen this program work really well for our products, and this is going to be extended through 1/1/23 effective dates. And as I mentioned, we didn't have anything for the MEWA in regards to specialty. Now we do. So this is for MEWA, UHC level funded cases, and ACA. And it's a premium savings. So basically a group just has to add on 2 lines. So they could add on dental and vision, and they can earn up to $3,000 in a premium credit. So the minimum premium is $7,500, and that would be a $500 credit back to the group. So this would really probably make sense for those groups that maybe have around like 50 to 40 employees. And again, this is just an extra savings they can earn on top of package savings for level funding and ACA. And it's something now that we can offer with the MEWA. We do have a really great flyer on this. If you'd like to see that, we can definitely send that out to all of you. And I'll just end the presentation today with just thanking you all for your time. We really just hope this was informative and excites you about all the new innovative ways that UHC updates our products. As you can see, we have 3 competitive small group products that have great value-added solutions. And we really set ourselves apart from other carriers in the small group space because we have a product that makes sense for each unique type of small business. And we want to always make sure that you know that you can feel free to reach out to your local account executive. If you have questions, we're always happy to help, and we're happy to educate too if there's any other topics you need educated on before the busy season. So again, just thank you for your time, and we look forward to a productive fourth quarter together.
Thank you, guys.
Thank you, Becky.
Thanks, Becky.
I'm not.
We do have.
I'm looking to see if there's any questions. Go ahead, Jeff.
We do have some questions, so I'll go ahead and ask them. So the first one of the requests was to show slide 7 again at the end of the presentation.
Slide 7.
7, yes.
Yep. This one?
One of the questions was, are we able to offer dual plan options?
Well, to let you know, for every single one of the products that we sell and we talked about today, so for the MEWA, for UHC level funded, and for ACA, we can sell as many plans to the group as they want. So the MEWA portfolio has 9 plans. We can hypothetically sell all 9 plans to a group. UHC level funded is the same way. And with ACA, we have what we call our multi-choice packages, and we were talking about the evolution package. You can sell every single plan in that evolution package. So we probably allow groups to do the most by not saying you can only offer 1 or 2 plans. You could offer as many plans as what's in the portfolio for all of our small group products.
Okay. How does motion work on non-HSA plans?
Okay, so that would be for UHC level funded and all savers. So with our MEWA, we only offer motion on HSA plans, and that's currently true with ACA. ACA is moving to the UHC rewards, but with our UHC level funded, basically what's going to happen is you will earn the money the same way you would as if you're on an HSA plan. It's just that we don't have you don't have an HSA account to deposit the money into that you earn. So basically you will get a check every quarter for that reward that you've earned. Now, the one thing I really do need to mention, because it is a little different, is with the non-HSA plans with UHC level funded, we do not give you what you earn as far as each quarter. It works like an HRA. So we will refund to you anything that you've had as a claim. So for example, let's just say in one quarter you've earned $200 in motion credits, but you only paid out $150 in claims out of pocket. We will cut you a check for that $150, send it to you without you even requesting it. That $50 of unused money will roll over to the next quarter. Ultimately, if we get to the end of the year and you have some money that you've earned but haven't had any claims to reimburse you, 50% of that money will roll over. So that's how it will work for non-HSA plans with UHC level funded.
Okay. What are the Kentucky and Indiana plans, core or premium?
I don't know if anybody on this call is going to be able to know that. This is a brand new program that was just rolled out, and we found out what Ohio is, but we can find that out for you and follow up if you can get us the name of the person that's asking that.
Okay, perfect. And then the final questions were if they would have access to these slides. All of our presentations are recorded and available on the Resource Center, so you can find them there. Becky, I'm not sure if you're going to provide the slides for this one as well.
I would be happy to.
Okay. And it looks like that's all the questions that we have for today, Becky.
All right, as long as there's no other questions, I think we're we're good to go here. I'll get the presentation sent out to everybody that's on the call. And if you have any questions, feel free to reach out to myself or your designated broker advisor.
And this is that one thing I wanted to just close with is, one thing maybe we didn't touch upon is why do we have 3 different, programs in small business? And our MEWA is going to be the most competitive. So that is the one that you should always lead with. It has the lowest filed rates. So for those groups that are going to be no risk or very low risk, and the MEWA is on average going to be definitely the most competitive product. Our UHC level funded is more competitive once we start getting medium-sized risk, and our ACA is the most competitive for high-risk groups. So, one thing I do suggest is when you're submitting for a MEWA quote to ask for UHC level funded, and other than asking, you don't need to do anything else. But we would say that most of the time the MEWA is probably going to be the most competitive, and that's definitely our lead product for the state of Ohio.
Thanks, Ed. I think we're good.
Thanks, everyone.